All right, thank you, Kathy, and thank you to everyone who is still with us for our final Ideas Showcase session of this year's meeting. So as always, we have 4 excellent presenters here this morning. We have first Mariko Toyoji from Communities Count in Seattle to present on their Climate and Health Indicators Dashboard. We have Kelly Davila from DataHaven in New Haven to talk about their report on health equity in Connecticut. We have Elly from Neighborhood Data for Social Change at USC in Los Angeles to talk about reflections on their equity committee. And we have Geethika, Fernando, and Jill Walsh from the Connecticut Data Collaborative to discuss the North Hartford Ascend resource map. So first, I will turn it over to Mariko. Wait, yeah, you can be there or at the podium, either one. Yeah.
Awesome. Hello, awesome. Thanks for sticking around. Hi there, I'm Mariko Toyoji, and I'm an epidemiologist with Public Health Seattle-King County, where I work on the Seattle Partner Communities Count, and then I also provide data support to our Climate and Health Equity Initiative. So it's a relatively new area and program for us at the County Health Department. It started in 2022, and really it's to provide support to agencies in King County and communities in responding to, planning for, and acting on preventing some of the bad and adverse health outcomes of climate change. And so there's a number of impacts of climate change on human health in this diagram, but really it's coming from the impacts of climate change exacerbating and creating new conditions for emerging threats. So part of that really important thing in understanding what's going on is public health surveillance. And so with public health surveillance and kind of this ongoing and systemic data collection, we're hoping that we can understand more about what's going on with health impacts as well as provide timely response. So one of our charges with the Climate and Health Equity Initiative is to develop a public health and climate change surveillance system. And so our colleagues and our team developed this process here for doing that. We wanted to take a look at what was out there, look at the work of people far smarter than us, including some NNIP partners, thank you Boston and Detroit, as well as looking at internally the data that we already had and we had expertise within the public health department on. We also formed a climate and health advisory group. This is largely institutional agency partners. We didn't quite have the resources to do robust community engagement, but we did get input from our sustainable, resilient, and frontline communities that is an advisory group formed by our Department of Natural Resources in King County. We came to consensus on selection criteria, really emphasizing the importance of being able to look at trends, meaningful disaggregation, and then also use the data to tell an equity story around disparities as well as informing other planning. We took a whole bunch of indicators and narrowed it down via consensus with the group to these 12 set of initial indicators, which we hope to also build on and expand upon in the future. Really focusing on things like air quality, so looking at asthma emergency department visits and also allergic disease impacts too. And we also wanted to take a look at extreme weather and the impacts there, looking at heat and cold related illness, emergency department visits, as well as calls to our emergency medical services, our ambulance services. Here, this big spike you see shows the ED visits from our elder residents during a really big heat dome event that we had in 2021. We also are tracking what's going on with food and waterborne disease locally. This spike you see here is when we had an outbreak of Vibrio in our shellfish population, which is an important local food source as well as industry. And we're also looking at vector-borne disease, which we don't have a lot of in the Pacific Northwest yet, and so we're taking a closer look at it. So there's a lot of zeros and ones. Hopefully it stays that way, but with climate change, the range of a number of vectors is kind of changing. We've put all these, we've developed indicators and put these data on dashboards that we developed in Tableau. It's available online on our website. You should just Google climate and health King County data. Better than that. But we also have some additional supports for using and accessing the dashboards, including a how-to video and some contextual narrative on those indicators. And we're continuing to kind of do some outreach and get feedback and input from our community groups as well on kind of what it means to kind of look and use climate change data. We've also engaged our hospital system and included it in our King County Community Health Needs Assessment for the first time. There aren't too many CHNAs that include climate, so this is an area that we're kind of hoping to continue to share with others too. Lessons learned, it's really challenging to wrangle data from across a lot of these systems. We started with health and health outcomes data, but we also want to integrate more environmental exposure data for context, but that's a new area of learning for us. Staffing and resourcing has been challenging, and we're still kind of figuring that out as a next step of kind of who does what among different priorities and staffing changes. We're also considering incorporating some of these data into Communities Count, our public-facing data platform. And I really just want to thank you all for the opportunity to share this work. Consider partnering or talking with your local health department about climate change and health. They're probably thinking about and working on it. And I want to give a big shout out to our Climate and Health Equity Initiative team. Thank you.
So I'm going to talk to y'all a little bit about a report that we released in 2023 where we were using mortality data to demonstrate health disparities in Connecticut. I'm also going to give you kind of a background on the project and how it started in 2020. This is something that obviously when COVID happened, all of this data started pouring out on dashboards. This is an example of ours. About like cases and deaths and hospitalizations and whatnot, but our partners started asking us like who actually is being affected by this and what are like the other externalities, how can we help other people, but we had only kind of indirect answers. So if we were looking at something like where would people who are most vulnerable be located, we had to go back and look at things like ACS data, different kinds of secondary research and stuff that had been done obviously previously. So from that, we produced this document that I don't know if I presented on, but I probably did in 2020 that was towards health equity in Connecticut. And it was a really long, really detailed, maybe overly detailed document that kind of summarized all of these social determinants and linked them to health outcomes kind of indirectly. But the message was really well received. The media was kind of able to pick it up and run with it. People were really thinking about equity at this point in time. But you know, the challenge for me was that the upshot was kind of complicated and no one was really talking about outcomes here. We were just talking about patterns. So in 2023, we wanted to update the report. And I had kind of been browsing the Connecticut Department of Public Health website, and I'm like, oh, y'all have all these reports that disaggregates all of this mortality data by things like race, ethnicity, and town. Like, can I have it? So I emailed, and they were like, sure, here you go. So we got, you know, from 2010 through at that point 2022, a bunch of demographic data in a mortality record level. So it's de-identified, but we do have race, ethnicity, age, town of residence, zip code, and up to 14 causes of death. So we were able to kind of use that information and link to other health outcomes that we can survey. You know, our DataHaven Community Wellbeing Survey can look at like, have you ever had diagnosed diabetes? And then let's look at how many people in that area are dying of chronic kidney disease. So we can make really direct links where we couldn't previously. And it was better than CDC Wonder because we don't really have counties that make much sense. So that was Health Equity in Connecticut 2023, a super streamlined report. 12 pages, basically, with not including covers and notes. So we also wanted to create this visual language to help people interpret like what we were saying in very clear ways. So anyway, to analyze that mortality data, we needed to do a couple of things with it. You need to age adjust using the US standard rates, and we were able to do that because we had race, ethnicity, and age in there, so we could just get cohort data and then analyze it that way. And then the ICD-10 codes, which if you don't know are the cause of death mortality codes, these are standardized across the industry, kind of let us do analyses that broke down by things like regions, so we could do like a legislative district or a hospital region instead of just a zip code or a town. So I just developed a couple of functions in R that helped us kind of quickly summarize that data, and it spits out kind of like, here's top cause or all-cause mortality by race, ethnicity, or by this region, and then a little more numbers to do years of potential life lost. So that let us better able to kind of tell this story with a better bottom line as to how these health and social determinants are actually impacting people, how many more lives are being lost due to these preventable in many ways causes. So that we wanted to create a report that was very clear and succinct, because the other one was really not. So we streamlined in a lot of ways. So for example, like our table of contents also doubled as an executive summary. So if you took one page away, you could get all the points. And then we also developed this vernacular for graphics to make sure that the trends that we were looking at, we were using standard deviations. So when we say this is worse than, how much worse than? And then this graphic is kind of reprised in all of these. This is one example. There will be a close-up in a second. So in the spread on the left side was kind of a layman's term, simple, like easier to understand explanation of what's happening in the chart next to it, but the chart is also using these, this 5-color scheme to demonstrate how different groups or different areas compare to the state. And because that's being used across every spread, the patterns can emerge where you see like, oh, the black population always has a worse than the state average, or Bridgeport or Hartford always have a worse than the state average. So that was one benefit of using that data. Where in the other report, we had used focus sections in each chapter. We wanted to focus just on gun violence in this report. In 2022, gun violence peaked nationally, so that was something that we were interested in looking at. And the ICD-10 data let us look at really, really detailed stuff like, was a person's cause of death a police-involved shooting, for example? So we could really like pare down gun violence into many different ways. And that also kind of let us debunk this a myth that people have that like Pistol Wave in New Haven, that we have terrible gun violence in Connecticut. We can compare that to like the national average to say, no, that's not the case. So super quick, thank you everybody. Sorry to be a bummer on the last day.
Yeah, I have a cheerful thing. Good morning, colleagues. All right, my name is Elly from USC, and this is a personal reflection on the processes, joys, accomplishments, and challenges of forming a committee dedicated to equity and participating in it for 4 years. These are my personal reflections on a deeply collaborative process, and so I'm going to try to use I statements. So for our research center, the summer of protests in 2020 illuminated that we didn't really have a collective framework or shared definition for racial equity in our work, that we didn't have a dedicated space to discuss it as a group, and that we were not going to get a lot of institutional support from the University of Southern California. So under the leadership of Victoria, my work wife, we formed a committee dedicated to equity, which really at its core is a space to create and practice a shared set of values and to just slow way down and be more intentional with each other and with our decisions. So some activities that we've undertaken as a group, we established this shared set of values that you can see here on the screen. We also documented our understanding of the historic and ongoing impacts of land and labor theft from Black and Native folks in this country, and we created land and labor acknowledgements. We also documented a shared set of definitions and language that we want to use around race and equity. Recognizing that USC's policy school has no curriculum requirements on race or equity, we created a seminar series for our research center staff and students to kind of teach each other and learn about these topics together that we've since opened up to the whole policy school, and you can see some of the topics we focused on the screen. We also launched a dinner club to build community and make space for discussions outside of work. So I'll just briefly share a couple of frameworks that I think have been really impactful for us in creating a culture that values equity, and they were shared with us by the brilliant and beautiful Saba Mwine Chang. The first is Elements of White Supremacy Culture, which is a paper by Tima Okun. So making space to sit down and talk about how these things have showed up in myself, the way that I move at work, and our broader work culture has had a radical and revolutionary impact on our workplace. This framework totally changed my life and my relationship to the world around me the first time that we did this workshop. And we've done it 7 times since with different folks, and I continue to learn and grow from it each time. Another frame that's been really helpful is understanding that an ideology like white supremacy impacts us from the outside in, so through the macro systems, through our institutions, into myself and my closest relationships. And the path to fighting it is the opposite. It's an inside-out process that starts with me and my closest relationships and then kind of moves out into community, into institutions. And so that's why our equity work has also focused on the framework of like love or appreciation languages. If creating a culture that values equity starts with me and my relationships, then learning how my colleagues want to be valued, appreciated, loved, and interacted with is a pretty radical idea, and it's been central to really building that culture for us. So I think my reflections on what it means to build a culture that values equity has really for me been about prioritizing the people in our workplace, the relationships that we have, and the community that we build together above most other things. Really trying to understand what everyone's unique contribution is to our community and really value it. It's been setting aside the game of like deliverables and fundraising and kind of climbing the academic ladder like the capitalist rat race, and really practicing thinking and communicating with radical honesty, really listening to the people around me, holding each other accountable to our values, and trying to love and appreciate folks in the way that they're asking. And I think the Equity Committee has created the container to do that when our institution doesn't have that space. So a couple challenges. Even when the whole thesis is for us to prioritize work that's not about money, it's still a big challenge because our institutions and our systems value money like more than anything else. And on a more personal note, practicing equity as a value is a really active process. It's not, something that I can learn once and check a box or like a project that I can finish, and it doesn't work in perpetuity if I don't continue to hold space and be really intentional. It's way easier to show up to the 7th Elements of White Supremacy training and just be like, I know this stuff, rather than like really actively interrogating how these things are showing up in my life right now, and they always are. And that can feel like a mistake, it can feel like going backwards, but I'm always reminding myself that progress is not linear, and that mistakes are really good and helpful and a necessary part of growing individually and together. If I feel like I've lost the plot of living in my values, I totally know what to do. I just pause and reset and pick it back up, pick the values back up, pick the work back up, try to move differently. And I think the Equity Committee has really made space for the pausing and reflecting part of that process when the rest of our work, you can kind of just get like lost in like launching the dashboard. So those are my thoughts. I just want to close in gratitude to my 2 colleagues that are here, Caroline for using her power as executive director to create this space, and to Cam, our current Equity Committee chair, for his leadership in keeping the work going even when it's really hard.
We are doing the finale for these, so no pressure at all. Good afternoon, everybody. Almost afternoon. My name is Geethika Fernando, and I'm here with my colleague Jill Walsh. We are from the Connecticut Data Collaborative to talk about another cool map we created with a community participation. I'll wait for the slides to come up to start the background, but until then I can start talking about the background too. So we are the data partner for a Promised Neighborhood funded grant. That the goal of that grant is to create a coordinated system of services and programs that serve families and children in the north end of Hartford. We are the data partner for that project, so as a part of our work, early in the onset for this project, we did a lot of data site visits with our providers, and a frequent question kept coming up: who else is in the service pipeline? Who can we collaborate with to refer our clients to? Where are they located? So there was a real need for a resource directory. So what we did was we took that need and request to the community work group that's a part of this grant to come up with a solution and a plan. The solution was to create an interactive, dynamic tool, not just for the providers, but also for the residents in the community. The idea was to create something that people can put in their address and they can find the services and programs that they need that are closest to them. And the plan was to collaborate with the existing 211 United Way service directory so that we don't recreate the wheel, so we can pull the information from them. And the other part of the plan was to collaborate with other community partners who are trying to do the same thing, like the Hartford Public Schools, the City of Hartford, and the other youth collaboratives, so we create something together for the whole community. And the whole focus of this plan was to have the community drive and guide the development of this tool. With that, our GIS expert, Jill, created a prototype of this tool, and then we took it to the same community work group to get their initial feedback. And we also had the tool beta tested out with frontline providers, the care coordinators in the community to get their initial feedback. We created another iteration of the tool. And our second step was to gather a cohort of frontline providers that included family navigators, care coordinators, and also family resource center staff at the public school district to field test this tool over a period of time and give us feedback. And also we did a focus group, a very interactive focus group with a group of residents to get their feedback as well, did another iteration of the tool and took it to the larger community of residents to do a soft launch and got their feedback. But with that, we did a human-centered design approach to do all this work with the support of our friends at the Connecticut Children's Hospital in Connecticut, but I'll let Jill explain the human-centered design approach more. Go ahead, Jill.
Thank you. So the human-centered design process was led by our partners, which was really helpful because we weren't like, we made this map, tell us what you think. So it was nice to have that kind of third party. But first we did think out loud testing. So providers used the beta tool and went through the map, clicked through as if they were working with a client, and just said out loud what they were thinking and what troubles they were having and what their initial reactions were. We also did a rose, thorn, and bud testing with residents, and that was challenges, opportunities, and strengths. Thank you. And so that was helpful, and through that we got a lot of this feedback here in terms of usability and accessibility. And since we had such a wide audience, this usability feedback was essential in making it a more useful tool for people. So one thing I want to focus on is we totally redesigned the map in a totally different platform in order to make it more mobile friendly because most residents were accessing the tool on their phone. So this is our new platform. This is the desktop version and then the mobile version. And we got feedback on what information to include in the pop-up, what to filter on, so you can filter on category and you can type in your address to get information closest to you. And there's also a feedback form on the About page, and we're planning trainings for residents and service providers to learn how to use the tool better, and we have a lot of outreach planned as well. We're hoping to have it in public libraries so that it can be kind of a first stop. When people are looking for a resource, they can come to this map to get started and then be able to contact organizations from there. And we've planned quarterly data updates, which will begin next quarter. And we have ongoing partnerships. We're in discussions about adding more resources. So right now we have childcare resources and 211 resources, which are super helpful. But we're talking with other organizations that are a little smaller and would love to be on it too. So thank you.
Okay. We have about 10 minutes for Q&A.
There was so much good stuff. We should. I just have a quick one for the Hartford team. Just resource directories are notoriously hard to keep up, I think. I don't know, how have you been thinking about sort of in a year, with the service hours and I don't know, organizations coming in and out and trying to keep it really live since it's so important. Real people are needing real things with real questions. So the stakes are higher than a report.
I can take that one. Is this on? So we've been working with 211 on that, and one thing that we're doing is if you're an organization that's in the North Hartford pipeline, we're really pushing that you need to keep your 211 resource information updated. And we've also been talking about, like, we have a spreadsheet of our partner organizations, and so we're updating that. But we're doing, like, the pipeline as a whole is doing a lot of outreach on the importance of keeping 211 data up to date and contacting them if they have changes in their operations.
As a fellow public health person, seeing all these MPHs up on the stage makes me really happy. And to hear all the work that y'all are doing is actually, I see, very interconnected. Working in local public health, I think I mentioned to y'all that like these resource databases are like things folks want, but we can't do with limited resources. So super shout out for that. My question for Elly is, when you're thinking about, I love the idea of, like, you're in relationship with others at work and you're there to love them and support them in the way that they want. When it comes to, you know, the outside bigger container and structure coming in, like, is there ever like some tensions that you all have run into, and like how have they been addressed? Like, do you guys have like a process in play, or are you mostly like relying on those bonds to like figure out how to navigate together? Like, kind of thinking about like having an inner hierarchy structure of like emergent, like response versus like, no, we're like kind of all level playing field, and what your thoughts are on that.
Yeah, that's a great question. I think we try not to be hierarchical about it. I think we try to rely on like relationships and talking to each other and working things out. I think when you're talking about concepts like equity, like white supremacy, definitely those things show up at work all the time, and they're difficult to talk about. So I think that, yeah, relying on kind of our relationships and our communication, like just kind of radical, honest communication as a basis, is like mostly how we navigate it. We don't have a lot of like stuff written down about the equity committee. Like, I think creating this presentation, I kind of realized we didn't have like a lot of, we don't have a lot of policies or anything like that. I think we're just trying to like be present with each other and kind of move and navigate together.
I have a quick question for Mariko, and then we don't need to drag it out if people are feel like they're ready for lunch. But just I saw like the mix of agencies. Like, were the climate and health agencies actually talking to each other beforehand? Like, I know King County is a special place where many things happen that don't happen elsewhere, but normally things would be siloed. And then also for the audiences, like, you have environmental justice groups, and you have the public health groups on the audience side. How are you bringing those different crowds in? Since NNIP is often such a connector.
Yeah, a lot of the agencies do talk to each other, but the Climate and Health Data Advisory Group was a new opportunity for people to be in a space together, develop some relationships and trust around talking about the data and some expertise. It's also become a space as it's evolved for folks to share other research they're doing, or share out and get feedback on data resources they might be developing within their agencies. We did not have quite the I think in the initial planning, we wanted to have more connection to a lot of the environmental justice groups and community groups that are really focused on climate change locally. We found that we didn't have the resources to really integrate them at this phase, but there are plans to kind of, as this grows and expands, knowing this is kind of the first step to look at health outcomes and looking at how we're going to kind of encompass more of those data that look at community resilience or adaptive capacity, bringing those folks in. And there's already been a lot of engagement through our strategic climate action planning with community groups. And so that was one of the groups that we were able to get some input on this initial set of indicators. But we hope that, as we build out some kind of this data system, that we can get more input via either that group or other places in which the county and kind of the nonprofit sector and community groups are continuing to kind of work and talk about climate change more and more. We do have a project that's emerging and is being funded through Gates Ventures on community modeling around climate change with a city in our southeast section of the county called Auburn. There's a lot of kind of health disparities and socioeconomic disparities that we see kind of converge there. And so that's a starting point at which we're hoping to get more engagement, and that work is kind of in its really, really kind of formative phase right now. But we might be able to report more out next year too.
All right, if there are no more questions, let's give another hand for our presenters for our last showcase.